We do have a lot to get caught up on, the very latest on the outbreak overnight. Just days after saying he wanted much of the country to open by Easter, President Trump has now extended social distancing guidelines through the end of April. Now, even with those restrictions in place, health officials fear the U.S. could face 200,000 deaths from the virus. And without precautionary measures, that number could jump into the millions. Well, as it stands this morning, there are now more than 142,000 cases and 2,400 deaths from coast to coast. Meantime, employees at an Amazon fulfillment center in New York and at Instacart nationwide, they're planning a major walkout today. They say the company should be doing more to address safety concerns amid a surge in demand. Now, we do have complete coverage. We're going to start with NBC White House correspondent Peter Alexander. Hey, Peter, good morning.
Hey, Hoda, good Monday morning to you. After expressing his desire for the U.S. to be back up and running again by Easter, the president is now deferring to his public health experts, extending those social distancing guidelines through the month of April, and for the first time acknowledging that the death toll here in the U.S. could exceed 100,000. From the president, a new timeline announcing the federal government's social distancing guidelines will stay in place for at least another month.
The peak in death rate is likely to hit in 2 weeks. Therefore, we will be extending our guidelines to April 30th to slow the spread.
The president Sunday backing off his hope that the country would open up by Easter, now circling a new date on the calendar when he says life will finally get back to normal.
We can expect that by June 1st, we will be well on our way to recovery. We think by June 1st, a lot of great things will be happening. Nothing would be worse than declaring victory before the victory is won.
It comes as the president is now bracing Americans for a significant death toll.
If we could hold that down, as we're saying, to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000.
The White House Coronavirus Task Force emphasizing those higher figures.
It's anywhere in the model between 80,000 and 160,000, maybe even potentially 200,000 people succumbing to this.
I think it's entirely conceivable that if we do not mitigate to the extent that we're trying to do, that you could reach that number. Yeah, it's possible.
The president stressing the U.S. is facing an unprecedented crisis.
I've been watching that for the last week on television. Body bags all over in hallways. I've been watching them bring in trailer trucks, freezer trucks. They're freezer trucks because they can't handle the bodies. There's so many of them. I've seen things that I've never seen before. I mean, I've seen them, but I've seen them on television in faraway lands. I've never seen them in our country.
Those comments following this dire assessment from Dr. Deborah Birx.
No state, no metro area will be spared.
A sobering reality check there from Dr. Deborah Birx. As for those dates, so April 30th right now, that's when the government hopes that they'll be able to loosen up those social distancing guidelines. June 1st, when the president hopes Americans will return to their normal lives. That leaves the month of May when Americans, according to the president, would hopefully be able to return to their work, slowly venture out to bars and restaurants and get back to a little bit of normalcy. Hoda and Savannah.
All right, Peter, we're going to talk to Dr. Birx in just a few moments. Also this morning, the CDC has put new travel advisories in place for residents of New York, New Jersey, and Connecticut as the region scrambles to create more hospital beds. NBC's Gabe Gutierrez is in Central Park, where a mobile hospital is being built. Gabe, good morning.
Savannah, good morning. Take a look at this. These are medical tents set up in the heart of Manhattan's Central Park, a dramatic sight as the number of COVID-19 cases skyrockets in and around New York City. The last 5 days have been the busiest ever recorded by EMS here in the city.
This morning, as an emergency field hospital is being built in iconic Central Park, New York, New Jersey, and Connecticut are now under a 14-day travel advisory. The CDC is urging people in the nation's worst coronavirus hotspot to halt non-essential domestic travel as cases top 70,000 in the 3 states with over 1,000 deaths.
Not a lockdown, something much more consistent with what we've been actually saying and doing in the city and state already, which is telling people to stay home unless they have an essential reason to go somewhere.
Today, the USNS Comfort is due to dock in New York Harbor. It will serve as a floating 1,000-bed hospital for non-coronavirus patients, freeing up beds on land.
We still have to take care of pregnant women who have to deliver. We have to take care of patients who need emergency surgery. We have to take care of kids.
In the Bronx, ERs are packed.
We are seeing a lot of younger patients that are coming through the door that are sicker as well, and that is surprising and a little scary.
Concerns are also growing about the lack of personal protective equipment, or PPE, for healthcare workers.
It's incredibly frustrating for us. Our coworkers are getting sick.
President Trump once again casting doubt on the amount of protective gear New York authorities are requesting.
We're delivering millions and millions of different products, and all we do is hear that, can you get some more?
Also in need, police officers. More than 5,000 members of the NYPD have called out sick. An estimated 900 are believed to have COVID-19.
We are hurting, we are crying, and we continue to fight.
The department is also reporting the death of its first uniformed officer, 23-year veteran Detective Cedric Dixon. 2 other civilian employees have also died.
May we never forget the sacrifice of those workers who put themselves in harm's way to keep you and your family safe.
New York City's mayor says there will now be fines for not social distancing in public here in the city, ranging from $250 to $500. As for this field hospital, it is set to open tomorrow. Hoda.
Okay, but still hard to believe that we're looking at a makeshift hospital behind you in Central Park. Thank you. Also this morning, a number of new cities are seeing huge spikes in coronavirus cases. Detroit, New Orleans, and Chicago all declared hotspots. And as the virus spreads, so does that urgent need for more medical equipment. NBC's Morgan Radford is in Detroit with more on this part of the story. Hey, Morgan, good morning.
Hoda, good morning. Simply put, the Midwest is now expecting a tsunami of cases. Michigan alone has already seen 5,000 cases of the coronavirus, and many of that is right here in Wayne County. In fact, the Detroit area hospital here behind me, Henry Ford Hospital, has already devised a sobering worst-case scenario where their doctors would essentially have to decide who gets life-saving treatment if those resources become even more scarce. America's Motor City now on the front lines in the fight against coronavirus. The U.S. Surgeon General now declaring Detroit a coronavirus hotspot. More than 5,000 cases have been reported in Michigan, and those numbers are expected to grow.
Our emergency rooms have been packed. We are literally running out of inpatient capacity.
Bob Riney oversees operations for the Henry Ford Health System in Detroit. In a leaked draft memo obtained by NBC News, the hospital outlines protocol in a worst-case scenario, saying they would give priority treatment to those who would likely survive. The hospital acknowledged the letter, tweeting, "We crafted a policy to provide guidance for making difficult patient care decisions. We hope never to have to apply them." Riney says hospitals are fighting a battle with no end in sight. Professionally, have you ever seen anything like this?
You know, I've been in healthcare for 40 years and been through a lot of different challenges that the industry has faced, but this one is different.
This weekend, President Trump approved a disaster declaration for Michigan, unlocking federal assistance to help recovery efforts there. But not before criticizing the state's governor, Gretchen Whitmer, and her response to the outbreak, tweeting, "Failing Michigan governor must work harder."
It's got to be all hands on deck. We are not one another's enemies. The enemy is the virus, and it is spreading, and it is taking American lives.
Detroit's famous auto show has been canceled this year. Now, FEMA reportedly plans to turn the downtown convention space, where it would have taken place, into a makeshift field hospital for coronavirus patients. While this Ford plant is now rushing to manufacture masks and other personal protective equipment.
Attention, please. There is no congregating allowed.
Cases are also skyrocketing in other major cities like Chicago, where an infant believed to be the nation's youngest victim died after testing positive for the virus. And down south, another American hotspot, New Orleans.
We are being as creative as we can be, but unleashing more equipment is something that we desperately need as well.
There are more than 3,000 cases in Louisiana, but in one town Sunday, hundreds ignored the state's ban on large gatherings to attend church services. American cities stretch to their limit as the virus continues to surge.
Interestingly, Michigan has put its manufacturing might into the battle against coronavirus, turning traditional auto manufacturing plants into manufacturing locations for traditional medical supply devices. Now, the governor did confirm that she received over 100,000 N95 masks over the weekend. The U.S. Surgeon General declaring Detroit a hotspot and saying cases could get worse over the next week. Savannah?
Morgan, thank you very much. And joining us now, the White House's Coronavirus Task Force Coordinator, Dr. Deborah Birx. Dr. Birx, good morning to you. It's good to have you with us.
Good morning. Good morning.
So we've heard this news now from the White House recommending that social distancing, what people should be doing, staying home, is expanded now for another month. The initial 15 days would have expired today, I believe. So what led to this change? What's the situation on the ground that requires this?
You know, we get data every day from around the globe, but more importantly from the United States. I think everyone understands now that you can go from 5 to 50 to 500 to 5,000 cases very quickly. We see this in many metropolitan areas. We're very worried about every city in the United States and the potential for this virus to get out of control, and we really believe that Americans with the right information will stay home.
And the president had said a couple of weeks ago he was hopeful, aspirational, that we could be back in business and packing masses on Easter Sunday. Obviously, this has changed. Now he's talking about potentially June 1st being a time that America could return somewhat to normal. Where are you on that timeline?
You know, I think we watch everything very carefully. We look at models, but we validate those models with the data that's coming in. And United States will look different than Europe, and Europe look different than Asia. And I think that we all have to be aware of that. It's not perfect science right now because we're projecting based on what we have today. And we know that the doubling rate of this virus is very high. And so that's why these 30 days allows us to really do both diagnostics, finding out who's positive because they're sick, and allows us to also get surveillance fully in place to really answer your question.
Yeah, you are in the middle of getting data, but you've seen quite a bit of data. I mean, to put it simply, is it worse than you would have expected it to be, or is it better? Is the social distancing having an effect?
I think in some of the metro areas we were late in getting people to follow the 15-day guidelines. And so we know that from the time you start doing everything that you need, staying home, social distancing, not going out to any restaurant, bars, or even being careful in the grocery stores, absolutely religious hand washing, all of this, we see some metro areas came late to that. I think it will be when this is over, we'll have a lot of time to really compare data about what really worked with this epidemic so that if it comes back in the fall, we'll be better prepared both with treatments, but also in really understanding how it spreads.
Dr. Fauci said yesterday we could see millions of cases in this country and as many as 100,000 to 200,000 deaths. Do you agree with that analysis? Is that a worst case scenario or something that we should prepare ourselves as potentially likely?
So in the flu models, the worst case scenario is between 1.6 million and 2.2 million deaths. That's the projection if you do nothing. So we've never really done all of these things that we're doing. We've put them into a model. We've looked at the Italy data with their self-isolation. And that's where we come up with, if we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities. We don't even want to see that.
I know, but you kind of take my breath away with that, because what I hear you saying is that's sort of the best case scenario. If everything works and people do the things you're asking them to do, maybe you can hold the deaths to 100,000 to 200,000 in this country.
Well, the best case scenario would be 100% of Americans doing precisely what is required. But we're not sure, based on the data that you're sharing from around the world and seeing these pictures, that all of America is responding in a uniform way to protect one another. So we also have to factor that in. Cities that don't social distances, that don't stay at home, that believe you can have social interactions, that believe you can have gatherings of homes of 20 and 10 people even, that is going to spread the virus even if everyone looks well.
Yeah, I was going to say, I believe on Meet the Press yesterday, you said that no state, no metro area will be spared. And I can imagine, you know, I grew up in Arizona. I remember watching things and thinking, oh, that's a big city problem. That's not going to happen here. What's your message to not just the metro areas, but to rural areas as well?
So this virus, we think, can spread with a lot of asymptomatic and mild cases. And it's not until it gets into the vulnerable groups that you start to see the hospitalizations. So if you wait for that, if the metros and the rural areas don't take care now, by the time you see it, it has penetrated your community pretty significantly. And that's what we're concerned about. And that's why you have to prepare even though you think it's not there.
Dr. Birx, I know it's a busy day. Nothing but busy days for you lately. Thank you very much for your time, ma'am. I really appreciate it.
Thank you, Savannah.
So, Hoda, our conversation this morning with Dr. Birx, and it is really stunning when you think about these numbers. You know, the worst case scenario being several million deaths in this country. But if we're all doing our part, they're hoping that they can keep those numbers down. But we're still talking about such a stunning human toll.
Yeah, and I can't help but think over the weekend I was looking at video in Brentwood, California of people at farmers markets, and I was looking at pictures of people still going to the beach, and you just want people to heed the warnings. Okay. What do you say, Savannah? We turn now to Mr. Roker. Why don't we get a check of the weather? Al's working from home. Hey, Al.
Hey, good morning, Hoda. Good to see you. Good to see all you folks. And it's the last day of March, but it doesn't mean winter's just quite over yet. As we take a look, and you'll see that we are expecting about 6 inches of snow possible in Maine as this system pushes through. We are looking at some wet weather making its way in. Also, showers and thunderstorms making their way through Texas, where we have a risk of severe weather today, damaging winds, large hail, isolated tornadoes. And then as we move tomorrow, more storms. We're looking at the risk stretching from Greenville, Mobile, on into Panama City. This system pushes to the east. Severe storms blossoming in the afternoon. Heavy downpours lasting overnight. Then we move into tomorrow with severe storms, more soaking rain into the south and southeast. Rainfall amounts anywhere from 1 to 3 inches and localized flash flooding possible.